Hello, I'm Dennis McKenna. Welcome back to another edition of Inside Albany Med. And I'm joined today with Angela Mextorf. Thank you very much for joining us. It's great to see you.
Thank you.
When we first talked about doing these videos, profiling members of our workforce, one of the very first people I thought about talking to was you. Because I think everybody knows you as a surgical critical care nurse with an incredible, stellar career here. And so this is an opportunity for us to learn a little bit about you. First of all, talk about your journey to getting to be a surgical critical care nurse. Did you always do that, or did you do other things before you landed here?
I started my career as a nurse on C4, which gave me lots of experience. Back then it was mixed infectious disease, so we did lots of wound care, lots of antibiotics. And then I wanted to do critical care, so I made the jump and came to ICU.
To stay in the same area for as long as you've stayed, there must be something about the care of patients in the surgical ICU that attracts you. What are some of the things that you like about working in the SICU?
I like seeing life up close. Everyone has a story. Someone once said a lot of people can do this job, but only certain people choose to live it. I think I've always gotten really involved, and I really like seeing people, taking care of people, and I like knowing their story.
I certainly have been walking through an ICU, or I've seen pictures on the wall of when patients who have been cared for in this setting come back and visit.
Nothing is better.
Right, and sometimes I'm going to guess those are a surprise to some of you when they show up. Talk about that. What's that like to see somebody who, when you saw them, they were on a ventilator with IVs and tubes and drips, and now they're back?
It's the best. Yeah. It's like people can give us all the candy, all the cookies, but when somebody walks in the door that we took care of, it's amazing. And a lot of times we don't recognize the patient. We always recognize their families, and their families always recognize us. So it's great to see people go full circle.
That's very powerful, I'm sure. You've been recognized many times, lots of different awards, obviously DAISY recognitions, DAISY awards. You're a pillar of nursing. What does that mean when members of either the care that you deliver to the family or colleagues recognize the work you do? What does that mean to you?
I never look for attention, but when you are recognized, it's really nice.
Right. One of the things that we're trying hard to do at the medical center is working on retention. We recruit a lot of nurses, but it's a very special person like you who stays here for their whole career. I know that you have certain things that you like to do within your own surgical ICU that works on team building and recognizing the new employees. Can you share some of those ideas with us?
Well, I really like to orient new nurses. I love the way they flourish. I mean, some of we call them my offspring, are here today. They're great. And now they're precepting people. And it's great to see them thrive. We try to do some things to draw people in. I have different activities we do. We make end-of-life blankets. We do fundraisers to raise money for our patients and their families so we can do nice little things for them.
We talked about taking care of people in the ICU. Sometimes it's the worst part of their life to come here after a tragedy. We're so proud about the great work sometimes, and the recoveries are fantastic and people leave. Sometimes, unfortunately, the outcomes are different, and there's nothing that can be done despite heroic efforts. Can you talk about what it means to you personally to be in the ICU and care for people at end of life, and what that toll is like and how that impacts you?
There's nothing better than seeing a patient improve, progress, move out to the floor, go to rehab, come back and visit us. But there's also something great to be said for helping somebody pass on to the next life after we've done all the things we can do to try to save them. And I really have, that kind of has a special place in my heart, where I think it can be pleasant. Usually we try to do little things to talk about the patients, like, what kind of music do they like, and have music in the background. And after people come in and they start to grieve, I will personally say, so tell me a story about so-and-so. And it's just amazing the life that some people live that you never would have known when you saw them, meeting them on a ventilator.
Obviously, you've been working in the ICU now for many years. What would you define as a good day for you? What are the types of days you go home and you say, that was a good day at work for me?
Sometimes my very best day starts out as my very worst day. You work really hard, and at the end of the day, you feel like, wow, this patient's better than when I met them at 7 a.m. I mean, I have some really rough days, but I really can honestly say, for the most part, I really enjoy it. And I think the reason I've been able to do it so long is you have to have balance in your life. You have to have things that you're really passionate about outside of work in order to be able to come back every day and do a good job. There's days I think, oh my God, I can't do this again. And then it's like, the next day it's like, I can do it again. And I kind of feel like my role as an ICU nurse kind of defines me as a person too. And I'm proud to be a nurse.
Well, I just want to end by saying thank you so much, not only for the opportunity to talk to you today, but really for everything you've done here at the Medical Center for your whole career. You've changed lives of both patients and staff. You are a wonderful teacher to me, and I just want to thank you for everything that you do, and thanks for being part of Inside Albany Med.
You're welcome.